सुप्रीम कोर्ट ने मना कर दिया था। किसने अर्जेंसी की राजकोट के रही
और चित्रा मैम, वी आर लाइव।
अभी मैं ऊपर जाऊं फिर सुनाई दे रहे वैसे ही।
कान का तुम लगाओ ना।
कान का लाओ।
और क्या
कान का कहाँ है?
हेलो, प्लीज म्यूट। दिनेश जी, प्लीज म्यूट। वी आर लाइव।
चित्रा मैम, should we start?
Yeah. Good evening.
Good evening, everyone. Chitra ma'am, you can start.
Yeah. Good afternoon, all the dignitaries who have this afternoon. You are the opinion makers in society. I welcome all doctors, general practitioners, parents, Rotarians, and Innerville members who have joined. And we are really grateful for your time. Myself, Dr. Chitra Kulkarni, is chairperson of AHA for this year with Raigad IIP and Palghar Academy of Pediatrics, who are the part of Maharashtra AHA and Maharashtra IIP, have chosen this topic for today with a very specific purpose. Dear colleagues, board exams are over. The school is having their short vacation before starting of new academic session. And everyone wants to enjoy. बस एंजॉय करना है, मुझे कुछ भी नहीं बोलना, मैं कितना भी टाइम मोबाइल देखूंगा, कभी भी उठूंगा, कभी भी खाऊंगा, ऐसा डायलॉग पेरेंट्स को सुनाई दे रहा है. But friends, our life has become a puppet of this market-driven economy. You are a consumer, no age bar, from womb to tomb. Friends, nowadays, you are not a person, a mother, father, or a child. You are now just a data generating point. And how to handle this? Human mind, emotions, sanity, and good moral values are to be revisited again and again for all of us. So, in this session, we make us aware about signs and symptoms of our teenagers who may require your help, timely intervention, and treatment to prevent the disaster. We request everyone to put your questions in the chat box, which will be answered at 4:45 p.m. onwards by the stalwarts who have joined. I can see lot of dignitaries who have joined, and I request you to keep your audio off to prevent the interference. Now may I invite Raigad IIP President Dr. Vikas More to welcome the guest.
Thank you so much, madam, for giving me the opportunity. On the behalf of IIP Raigad, IIP Palghar, and AHA Raigad, I welcome all of you. This is a very important topic. Everyone is facing it. And for that, we're having the expert like respected Shailaja Mane madam, who is a professor in HOD Pediatric of Dr. D.Y. Patil Medical College. And on the top of that, we're having Bhabe madam as a guest of honor. IIP Palghar is a very brotherly branch to IIP Raigad because Jayashree madam has a very affection for us, and it is possible because of her sister, Dr. Chitra madam. And I see respected Joshi sir, Joshi madam, Kokar madam, we are fortunate to have your darshan. Please bless us. We are having this activity. And being a father to a teenager, I feel that to be a parent of a teenager is more problematic than being a teenager these days. Because teenagers are growing at their own pace, but we are not growing mentally at their pace. So I used to appreciate a lot in his childhood, but I might not be appreciating that much when he has become a teenager. And that might be the root cause of the problem which the teenager is facing. I remember a very beautiful poem by Hridaynath Mangeshkar that Manasisa Chitrakarato Tujhe Nirantar Chitrakaduto. So we should always remember that we draw of our child with our own wings and with our own understanding. And it may be wrong. So we need to understand them. And to understand them, we need to attend the CMEs like this from the experts like Dr. Shailaja madam. Over to you, Chitra madam.
Thank you so much. And I could identify Nagpur stalwarts, Dr. Nishikant Kotwal sir and Dr. Jaya Shivalkar ma'am who have joined. Thank you so much, ma'am. Now may I invite Palghar Academy Pediatrics, Dr. Jayshree Deshpande, who is president of current year, to introduce our guest of honor and then speaker.
Thank you so much for involving us in such a noble cause. May I have the slide of Dr. Swati Bhave, madam? Dr. Swati Bhave, madam, is a pioneer in adolescent health medicine in India. She is an executive director of Association of Adolescent and Child Care India. In her UG and PG days, she has received many awards and she is a gold medalist. She is the motivation behind many NGOs running across the country and worldwide. She has done phenomenal work in research, social service, and academics in international associations like IPA, Indian International Health and Adolescent Health Chapter, American Academy of Pediatrics, and she is at present busy, but right now, madam, we are waiting for you to join this webinar and join according to your convenience and give us blessing. Thank you. And Dr. More, I'm really happy and thankful for your involvement as a brotherly, but I would correct that we are a sisterly branch now.
Okay.
Yeah.
Maybe because I'm a male, so that's why I called for them.
Yeah, but I'm sisterly branch. I'm happy to
Okay.
be associated with you on such a dynamic and a vibrant branch. Thank you.
Thank you.
And now the speaker.
I
Dr. Shailaja.
welcome Dr. Shailaja Mane, madam. She is the professor and head of the department of D.Y. Patil Medical College, Pune. She is the young and dynamic lady with many feathers in her cap. Recently, Madam received the prestigious fellowship of IAP. Madam, we are eager to learn from you. With your
Yes.
expertise in adolescent health, Dr. Shailaja Mane, Madam.
Thank you. Thanks a lot. Very good afternoon to all. Thank you, Dr. Jayashree and Dr. Chitra. Thank you, Dr. Jayashree, for your kind words. And I'm very happy to feel the enthusiasm to learn about the adolescent health. That is so encouraging to me also. And the people who are working in adolescent health. And thanks for joining the Karwa for adolescent health care. And thank you, Dr. Vikas and Dr. Neha, for nice introduction of the topic. And I think I would like to share the screen. 1 second. Are you able to see?
Yeah.
Yeah, okay. So at the outset, I would like to thank again all the organizers and all the enthusiastic general practitioners, parents, and of course the pediatricians. And of course, it is a teamwork to nurture the adolescents in our country, and it may be at any level, but we must join for this noble work. So we'll see about what are the red flag signs in adolescence, particularly in teen problems. I think it is not moving.
No. Yeah.
Okay. So what is the importance? Why red flag signs? Why this topic is kept? It is a very important topic, and I thank again Dr. Chitra for understanding its importance and giving me an opportunity to share the views about this topic. So we all are primary care physicians, including all of us. And mother is the first physician, or mother is the best physician, what we say always. Mother and father. Of course, whenever I say mother, it is mother and father, parents and grandparents. So it is, we see a broad range of problems. And broad range of problems needs broad knowledge also to manage the particularly teenage patients. So we encounter patients at various levels, wherever it is undifferentiated stage. What we can say, it is undiagnosed, undifferentiated stage of the disease or any condition. It may not be always disease, and there is marginalized risk of missing the serious illness. So we may miss some clues or some flag signs, and it may create some serious health consequences or life consequences for the teenager in the future. So we must look for the red flags, which are the clinical indicators of possible maybe serious underlying condition. And these are the signs and symptoms which are found in patient's history or clinical examination or some clues. So it is said, no, what mind doesn't see, eyes will not see. I'm telling in reverse way. Okay, so our mind has to see. So it is of paramount importance for the decision making to evaluate about the red flag signs. So that's why today's topic is arranged. So there are various indicators for the red flag signs. So all red flags may not be highly diagnostic or not at all highly diagnostic sometimes, but it can be highly diagnostic or not, or it can be general or specific, but they definitely warn us about the possibility of some disorder or some issue of the health. Second thing is, can you mute please?
Yeah, done.
Identification of red flag signs warrants the investigations or at least or both referral to the further healthcare facility. And it should be an integral part of primary care because it is of immense value. So red flag signs are warning signs that indicate unhealthy or manipulative behavior, and they may not be always recognizable at first interaction. Which is very important because that's why it makes us so dangerous. So we must have that angle to look at it, and they tend to grow bigger and become more problematic over the period of time. So we must identify them at early stage. Particularly, for example, in the relationship, red flag signs may manifest as controlling behavior, lack of trust, low self-esteem, some physical, emotional, or mental abuses, substance use, then narcissism or anger management issues like that. So in short, red flag signs are warning signs that indicate potential problems in various areas of life. And these are the signs and symptoms found in patients' history, clinical examination, or even parents' history. And that may give a clue for the serious disorder or serious pathology one. So it can be divided into early flag signs, which are early identification and notification to be concerned. And red flag signs are alarming signs to be addressed immediately on emergency basis. So that's why the name is red flag signs. And for example, we can say about adolescent mental health disorders or difficulties. So it can be internalizing or externalizing. In internalizing, we can have depression, anxiety, certain phobias. And in externalizing, ADHD, attention deficit hyperactive disorder, substance use, juvenile delinquency, conduct disorders, etc. So we will just see general flag signs. In general, deterioration in the scholastic performance. This is the common general flag sign. It can have multiple causes. We'll see at the end. I have kept one slide for that. So deterioration in the scholastic performance or overall performance, absenteeism in the school, lying, stealing, running away. Then it can be social withdrawal, isolation, because we have seen externalizing and internalizing. So these are the externalizing signs and now internalizing. Sorry. So that is social withdrawal, isolation. And they can go into the high risk behavior like tobacco, alcoholism, and nowadays, last few months back only, last month only, I think, there was more than 3,500 crore drugs which were cashed in Pune. And I am sure it is just a tip of iceberg. So we must discuss about the drugs openly now, early identification, prevention starting with, but early identification and management as well. So then poor personalization, because adolescents at this age always feel that they are on the stage. Dr. More had recited one poem and उसमें वही था कि they always feel कि they are on the stage. कोणीतरी त्यांच्याकडे बघत असतं, असं सतत वाचत असतं. So they are having the life stage where they will feel that they should look properly. They should look like a hero or heroine. But if there is poor personal hygiene, it is again a general flag sign. There can be disturbed biorhythm. Biorhythm is disturbed sleep, disturbed appetite, and thanks to various social media now, it is again adding to the problem. So we'll see about generalized anxiety disorder. 1 second. Yeah. So it is a stress behavior. I have kept this slide purposely because it is common and it is increasing nowadays. So it can have physical signs like excessive anxiety or worry. They are always restless, tired, irritable, exhausted. They can have disturbed sleep, insomnia, or they can have muscle tension, myalgia, in general myalgia, generalized body ache. They can have difficulty in concentration. They can have some somatic symptoms like headache, stomach ache, muscle pain, tiredness, palpitation, sweating, even cramps in abdomen, insomnia, and there can be psychological issues like nightmares, indecisiveness, impaired judgment, crying, frequent crying, particularly in girls, and in boys, frequent anger. It is not 100%, but it can be vice versa also. They can have feeling of helplessness, hopelessness, and ultimately deterioration in the scholastic performance. And socially, they can have withdrawal behavior, deterioration in scholastic performance, and many times panic attacks. I have handled many adolescent, not only adolescent, but young adults also, which are having panic attacks, and the way they were behaving and anxiety in the parents also. So this is the situation. You can see कर्णाला कशी कवच कुंडल होती ना, तशी ती आता बहुतेक पुढच्या पिढ्यांमध्ये येतील असं वाटतंय. So 1 second.
This is very, very important.
Yeah. So addiction of media is again burning issue nowadays. Yesterday only one that boy is in now engineering college first year, and the relatives, he came first, but relatives were telling many things about addiction. So they can have impulsive behavior, and then they can have obsessive thoughts also, and they can have poor impulse control, inability to seize or withdrawal because they are addicted, of course. They कळतंय पण वळत नाही अशी सिच्युएशन राहते. Good afternoon, madam. Dr. Swati madam had joined. Good afternoon, madam. They
You
can have-
please continue. You
Yes,
please
yes.
continue.
Yes,
Yeah.
yes, madam had already
Continue
told.
your lecture. I will speak at the end.
Yes, madam. Madam had already told me, but spontaneously I did.
Yeah.
Yeah. So there will be a sudden change in the mood. They can have insomnia, anxiety, with reduced or loss of access to the media. आम्ही जेव्हा आठवतंय मला की बऱ्याच वर्षांपूर्वी बाहेर गेलेलो होतो तर तिथे हे नव्हतं, नेट नव्हतं. तर हे सगळे जे टीनेजर्स होते काय करणार, आम्ही इथं काय करणार, सारखं दे वेर मीन्स सो मच रेस्टलेस की आता हे नाही आहे आपल्याकडे, मोबाईल नाही, नेट नाही, व्हॉट वी शुड डू. So they are always having that issue. They can have depression and loss of motivation for even daily activities like bathing and having some keeping themselves neat also. And that can lead to various sexuality issues, attention deficit disorders, etc. So what are the red flag signs in ADHD? Difficulty in concentrating. They can have long enough it can lead to they cannot concentrate enough to produce the satisfying result. That's what they feel. They can have disturbances in the peers, in the classes. They can disturb to even burst out. They can't wait for their turn. They have awkward or clumsy behavior, frequent absenteeism, vindictive behavior, poor communication skills, and they may have this repetition of the behavior again and again. And they move constantly, talk rapidly, cannot wait for their turn, and they can have trouble in focusing a new task. 1 second. I will just stop.
It is the same presentation, no? Yeah.
तेच मला
This slide was going on.
yes. तेच मला बघायचं होतं. Okay. So
Yes.
So in major, so this was about ADHD, and in major depressive disorders, these are the red flag signs like lack of interest in activities which they were enjoying previously, like playing with friends or having singing or playing any instruments like that. But they will lose the interest in that. They will have low mood, frequently in between irritable also. They will have sleep disturbances, change in eating behavior, whatever they will like to enjoy eating, they will not anymore, or they will have wish for the death, or they may have attempts to do self-harm also, and sometimes aggressive behavior also. But we must remember that if there are some these symptoms which persist for more than 2 weeks, 15 days, so we should refer the patient. And adolescent depression, this is the difference in between adolescent depression and adult depression. They can have internalizing or externalizing symptoms, which we have initially already talked about. So there are certain flag signs for SLD, specific learning difficulties or disorders, what we can say. So they can have a reading problem, which can be slow or effortful. They can have problems in reading comprehension or writing, problems in reading written expression also. So they will have spelling mistakes, different spelling mistakes. They may have problem solving difficulty, or they may be poor in maths. So whatever specific issue is there, they will have symptoms accordingly. They can have, they will read single words properly, but connected text, they will not be able to read it properly. So they will take more time, and they will need more efforts, and they will have trouble in pronouncing the particularly multi-syllabus words. So there can be a problem with the reading of the written text, and they may frequently need to reread the material so that they can understand to get the main crux of that particular point. They may avoid both leisure and work-related activities that demand reading and writing. Just they will avoid. Many times they will not be able to understand what they are having the issue. So it is very important to catch them early, and because we have seen many adolescents, they were diagnosed for SLDs during their 9th and 10th standard, when already board exams are on the way. And we all know that they are having extra time is given to them, or some writer is given, or some help extra is given if we apply properly within time. So it is important for them that we should identify at the earliest. So I will not go into the details, but in that we can give some alternatives or some alternatives or some flexibility in the exams also. So coming to burning point now, what are the early flag signs in the addiction? There will be effort to mask the smell. Particularly, they will have, for example, frequent rinsing of the mouth, using the mouth freshener, using perfume or chewing the mint, because they will try to avoid this smell of the smoke or particular drug. They will not have eye contact properly, or they will avoid the hug of the parents, because जादू की जप्पी आप सब लोगों को पता है, एक जादू की जप्पी से बहुत कुछ समझता है. And always we tell whenever we take the parenting session. Last week only I had given a talk for anesthesia society, and जादू की जप्पी देने के लिए बोला था मैंने उसमें. So they will not like that, and there will be many times, most of the times, there will be set of new friends which are particularly senior one, and they might have indulged into such activities, and they will drag this particular teenager into that particular friendship, so-called friendship, and then problems. They will have social isolation, loss of interest in enjoyable activities which they used to enjoy previously. They will spend extra time in the toilet. For what? For doing this task. Okay. They will have poor hygiene, appetite will be disturbed, sleep will be disturbed, and to fulfill the demand of this addiction, they will have stealing, history of stealing from the house or some friends or some neighbors, even from the common areas also. Stealing of something so that they can sell and they can fulfill the demand of money to buy this particular cigarette or whatever they are using. Then they will have changed preference for movies and music, particularly loud and certain kind of music they will like, particularly rave parties or like that. They will have unexplained irritability. They will be there physically only in house, but mentally they will be somewhere else. There will be increasing the conflicts between the friends, between the teachers, even of course with the parents and siblings also. They will have odor to but their breath. There will be staining of the lips, teeth, and tip of the fingers. And if they are taking drugs, there will be puncture marks also. So this was about the addiction. Coming to the flag signs for the sexual abuse. Sudden change in behavior, particularly withdrawn behavior. There will be phobias of various kinds, depending upon who is the culprit. They might try to run away, suicidal attempts and thoughts. Then they will have emergence of sexually related problems and changing gait. And there are so many, but I'm just talking few of them which are of importance. So coming back to substance abuse, this slide came in between, so disrupted the flow. Anyway, so there will be physical, psychosocial, and academic indicators, which all, as parents are also there in the group which are listening to me, so, and general physicians also, we must remember this slide. There will be snuffles, there will be chronic recurrent cough, red eyes, hoarseness of the voice, blank staring look, and then needle tracks if they are using drugs. Coming to psychosocial, there will be swings in the mood, higher behavior, multiple conflicts, issues in between parents, siblings, and even peers. Isolation from the society, hygiene will be poor, sleep and appetite will be disturbed. And academic, we already seen that there will be academic backwardness or falling academic grade. The interest in the academics and to learn the topic will be lost. There will be aggressive behavior. They will have sleepiness during the school time or college time. They will be inattentive. Whatever is going on, they will not be able to concentrate. And of course, stealing we have discussed. So this slide was just before that. So red flag signs for the suicidal ideation. Many times this, suicide occurs within seconds, but the preparation of it starts maybe years or months before. So we must catch them at that particular stage. Many times they will have verbalization. Okay, मला जगावंसच वाटत नाही. We should not take it lightly. Even over treatment is okay, but we should not miss any case. They will have verbalization like I'm not having any interest, I want to die and all those things. Last 2 months back only there was one girl, adolescent girl, who had attempted the suicide, and then by the grace of God, that chundri was slippery and that girl fallen down. And parents came in my OPD when in my private OPD when we were having a lot of rush actually. And when parents told that she had attempted the suicide, then I have taken her immediately and whatever done the needful. So we have to take it as a medical emergency, attempted suicide. Even verbalizing should be taken seriously. Even though it is not emergency, it had to be taken seriously so that we can avoid one death. So there will be indirect or direct expression of the death by, and they can acquire the means of the death and like how to do the suicide and all. They will start collecting the means to do that, or they can have some plan or preparation. So all these things to be taken very seriously. They can have feeling of hopelessness, helplessness. They will be sometimes unusually cheerfulness. Means तुम इतना क्यों मुस्कुरा रहे हो, है ना, क्या गम है जिसे छुपा रहे हो, ये भी हो सकता है depending upon the personality. They can have self-hatred, particularly after sexual abuse. This feeling may be seen. They can start doing final arrangement, saying goodbye to favorite person or giving away the things which they like, favorite things which they will never like to give when they were normal. There will be deterioration in the academic performance, social withdrawal, loss of activities. They will have entered into the various high-risk behaviors like driving fast or taking high-risk behavior in the forms of indulging into antisocial activities even. They can have mood and behavior changes. So it is our task as a parent, as a healthcare worker, and as the support system for the teenager that we must identify who needs help. Because these, whatever signs we have discussed just before, these are the signs for crying. That is actually cry for help. We should identify. So whenever any teenager appears sad or appears upset or cries often, they are not taking part in any fun activities. They are irritable, easily becomes disturbed, or they become angry. They will have frequent non-specific physical complaint, particularly headache and body ache, headache and pain in abdomen. So what we say is psychosomatic, because 95% of the diseases may have psychosomatic base actually, disturbances. So we should not take it lightly. We must rule out the organic cause also. They will have absenteeism from various classes, which may be non-academic also and academic also. Poor academic performance, poor concentration, sleeping in the class, post and quotes, particularly on the Facebook, Twitter, or any social media. Sushant Rajput had done that. And there are many examples which they have done, and we can catch hold of them. And I remember the conference where our youngsters from Aki Youth Wing had beautiful session in the World Health Conference where they have done workshop on this. So whatever they are posting, some parents or some friends must monitor and catch it, and they should inform to the parents or whatever healthcare worker, or they may have peaks of disturbed mental state also. Then they may express the wish to do direct or indirect harm. So these are the features of distress in short. Physical symptoms, again, physical, psychosocial, psychological, and behavioral. Physical, headache, sweating, stomach or body pain. Then flaring the pimples, frequent infections because immunity will be disturbed. There will be thumping pain in the chest. In psychological, poor focus, forgetfulness, tearfulness, easily. Then they might feel deep sadness. They will have a social isolation, poor hygiene. Already we have discussed this, poor appetite and sleep. These are common actually. And suicidal ideations or thoughts. In behavioral, they can have irritability, aggression, excessive angriness, disproportionate anger in fact. And they will have disturbed relationship that can add on the problem. social withdrawal, and ultimately self-harm. So World Suicide Prevention Day is, I can't say celebrated, it is followed on 10th September every year. So these are the signs which we should communicate with the parents and teachers and even teenagers, because peers can help to avoid that. So scholastic deterioration is a symptom or sign of various problems like simple health related issues, hearing problem, visual problem, maladjustment with the school, teachers, peers. They can have bullying also in the school, and that is even common nowadays. Then they might have study related stresses also, like learning difficulties, and they might indulge into the bad company. And this love affair is again because इस age में तो सारा attraction maximum रहता है. But some sensitive or some people who are having very light heart, what we can say, they can have broken heart problem. They may indulge into sexual experimentation, which to some extent is can be taken as normal in adolescent age group, but that can lead to sexual abuse or it can lead to some other issues also. Another problem is cyber addiction, like media, mobile, various social medias. That is again one of the increasing issue, and that can lead to other issues as well. Substance use like tobacco, alcohol, drugs, and even major problems of parental issues. Because our adolescent or teenager or child is the reflection or result of whatever problems that happen in the home or home environment, particularly parental issues. And last 15 days back only, there was one case which was referred to me who was having dysphoria, sexual gender dysphoria, but ultimately that might be the additional problem, but parental issues were there. So that was an addition to that. So we have to look for it, and ultimately we have to take help of family counselor. So in short, what are the behaviors that concern in teenagers is verbal aggression, lack of frustration or tolerance, lack of impulse control, behavior, difficulty with physical image. Even किसी को लगता है कि नाक छोटा है, कान छोटा है, कलर ऐसा है, हाइट ऐसी है, वेट ऐसा है. So even advertise पण आपल्याकडे कसे असतात, एक पिंपल पूर्ण दुनिया बदलून टाकतो. So media literacy is again very important task of the parents. So just to enlist, what are the red flag signs about recognizing the disturbed behavior of the adolescents? Extreme isolation. So we all must take care of it. Extreme isolation, sudden and severe change in academic performance, substance use and abuse, unexplained physical changes, drastic personality shifts. Because yesterday's case, which I was referring to, that boy was means all right till last term, and this term he had suddenly changed. The parents तर असं म्हणत होते की हाच तो मुलगा आहे का असं मला वाटतंय, म्हणजे खूपच बदललेला आहे. That is drastic personality shift, change in sleep pattern, risk-taking behavior, obsessive thoughts and behaviors, withdrawal from various family activities. This is again to certain extent is teenage behavior, but the sudden change is the main keyword. Then frequent illness, complaint of not feeling well, just एक शब्द मला बरं वाटत नाही, बस काय वाटतं ते will not be able to specify. Decline in personal hygiene and disinterest in previously enjoyed activities, frequent troubles at the schools and with the troubles with the breaking the laws also, antisocial behavior even, expressing feeling of worthlessness, hopelessness, helplessness. Then significant change in eating habit. They might eat less or they might eat more, both anorexia or bulimia. Then secretive phone or internet use. माझी personal privacy, these are the words which they use. And even that particularly yesterday's case, again I am referring because this is fresh one, that mother was saying की कोणाचा फोन जरी आला ना त्याला हात जरी लावला तो एकदम violent होतो. Okay, so they are trying to hide something. They can have persistent boredom and apathy. काहीच करावंसं वाटत नाही. They will use of dark or violent imagery. These are the various red flag signs about behavioral issues. Coming to few last slides. But we have seen what is importance of red flag signs, but there are certain limitations of red flags also, because recognizing and managing in clinical medicine also presents challenges, because it may not be always true. म्हणून एक red flag sign वर नाही, overall we have to think, because all red flag signs do not have an equal diagnostic power, and some are highly diagnostic but some are far less diagnostic. Particularly जे depression चे signs पाहिले किंवा suicide चे, they are okay, but there are various general signs and there is a lot of overlap also of conditions and red flag signs. Even in the presence of far less diagnostic red flag signs does not exclude the possibility of serious pathology. So ultimate clinical judgment and experience matters a lot. So these are the take home messages. Teenage behavior is, because in teenage we must know what is normal. Then it is very easy to identify what is abnormal or what should be taken as a real red flag signs, because teenage behavior is complex and there are a lot of changes which are happening at various levels. They are having physical change, emotional change, hormonal change. They are seeking for the independence. They are searching for their self also. So it is actually complex stage of life, and teens development trajectory is laden with emotional ups and downs, which to some extent is normal, and they need independence, and there is lot of influence of social events which are happening. So understanding these aspects are very important, because at the same time we want to build the resilience also. We have to build their life skills also. We have to build their empathetic relationships also. So it is really a difficult task. Dr. More said, but I always feel that it is enjoyable task as well. So red flag signs particularly are important, that we should identify them at early and mitigate them before it becomes a problem and it goes at next level. So recognize the normal behavior and what are the red flag signs, so that it will build healthy relationship and better mental health will be there in the adolescents as well. So always open a dialogue. We must do as a healthcare worker active listening, and don't hesitate to take professional help whenever required. And we always should have this supporting structure as a healthcare worker: parents, teacher, physician, general physician, adolescent health physician, pediatrician, and other special healthcare workers, counselors, psychiatrists even, because whenever there are danger signs, we must take help of professional, and professionals must take help of particularly psychiatrist who is having the angle of managing the teenagers as well. This talk was prepared for the ITPA actually. International Advanced Training Program was conducted by us. Dr. Swati Bhave Madam had helped us to organize that, and through AKI we have done it in 2019 and have added some slides which are of relevance today. I am very much thankful to Dr. Swati Bhave Madam for that. So we must understand that adolescent health is not only families and that particular person's importance, but it is of nation's wealth as well. So we must help them to become champions in their life, like this Under-19 World Cup, and help them to have beautiful relationships and beautiful life which they can enjoy ahead. Thank you. Thanks a lot again.
Thank you, Dr. Shailaja. Your speech gave us much needed insights about taking care of our teenagers. And the new insight was about specific learning disability, which may take time to diagnose. And all the parents, I request that they should be aware of this, कि नहीं ये CBSE में ही जाएगा, ICSE में ही जाएगा, ऐसा उनके पीछे मत लगो. Find
Yes,
out
because we always say की आपली मुलं आपल्या राहिल्या सुरलेल्या ज्या काही आशा आकांक्षा आहेत ते कंप्लीट करण्यासाठी या जगामध्ये आलेली नाहीत, ते इंडिपेंडेंट आहेत. Yes.
Even I like the last picture of take home message where all people are skydiving holding their hands. So that is teenage is like a skydiving adventure, and we have to hold hands, understand and support them. Thank you so much, Dr. Shailaja Mane, Madam.
Thank you, Jayashree.
Thank you. And today is World Water Day. पाणी म्हणजे जीवन, the vital of our existence. And I compare this with our living legend, Dr. Swati Bhave ma'am. She is inspiring us for last so many years. And again, I'm requesting her to tell something more about red flags and today's problems of teenagers. And she's practicing and getting various new insights about day-to-day activities. Mindfulness is one of them. I like it very much. Over to Dr. Swati ma'am.
Chitra and Jayashree for inviting me for this webinar. With both of you and Shailaja, the speaker, I just couldn't say no. You know, I'm restricting my webinar activities nowadays, but you three are very dear to my heart. And that's why I'm very happy.
Madam, thank you. Thank you.
And Shailaja gave an excellent lecture, an excellent overview of all the flag signs. And what I would like to only add from my practical experience, I have started a new center at Jahangir Hospital Wellness Center. This is a new center totally away from the hospital. And I started a new department called Family Guidance Center. Because the moment you talk of counseling or you talk of any psychiatric or this, the adolescents don't want to come for this center. So by calling it Family Guidance Center, and we saying that we give advice and guidance to parents and grandparents and adolescents, they understand that the behavior change is also going to be told to their parents. And that is why they are much more happier to come. Here's a doctor who changes our parental behavior also, and not just hoping that we are bad children and we are being asked to improve our life. We also take grandparental in our guidance because many often the children are left more under the care of grandparents with working brain. And I've also not only managed adolescents, but I'm also managing young adults from 20 years to 30 years. So we have this vast experience, and many adolescents which are brought to us are always, of course, troubled adolescents or difficult adolescents from the parents' point of view. And very often they're not really difficult or troubled adolescents. They have flag signs, but then in reaction to their parental behavior. So it's very important to understand that are these flag signs reactive? That means if you have a dysfunctional family where the parents are constantly fighting, they have a marital discord, and they may not beat the children, but there's a lot of emotional abuse. And you know, many parents start giving a lot of labels and names to the child. And when the child does something which they are not happy about, the lecture can go on for 1 hour to 2 hours. And in that, I always tell them you may not have beaten your child, but every word which you use, every label which you give is like an emotional slap to the child. So in a 1 hour to 2 hour lecture, you have slapped that child at least 100 times. And then his behavior, which may be aggression, which may be withdrawal, which may be lack of interest in studies, which may affect his sleep pattern, his eating pattern, all the behavioral problems are not because that adolescent has some pathology or some organic disease, but these are in reaction to the bad atmosphere which the child has at home, which is not nurturing, which is constantly abusing, and they do not have a connect with their parents. So when you take a detailed history, as Shailaja has given the very good flag signs, but some of these flag signs like change in behavior, appetite, aggression, withdrawal are common to many problems. That means a child who has got depression will have the same signs. A child who has substance abuse will have the same signs. A child who is being bullied in school will have the same sign. A child who's in a romantic relationship or who's being dumped, especially on the Facebook, we may also come with the same signs. So flag signs are some which are universal. And by taking a detailed history from the parents and from the adolescent and the child, we can then start pinpointing whether this is a pathology. That means, does this child have a personality disorder? Does this child have some problem like a ADHD or an oppositional defiant disorder or a conduct disorder, substance abuse? Or is this child just emotionally upset? This child is not a happy child. This child is going into early depression. This child is being bullied in school. This child has some problem like, as Shailaja said, the learning difficulty. So what happens is these children up to 8th standard can cope up quite well in school. And because there are no exams, they're being constantly promoted. The borderline learning difficulty or ADHD may be missed. And after 8, the school suddenly gets up, they become vigilant that we want 100% result in the SSC and the BSc. And then suddenly the parents get a big notice that your child's academic performance is very poor. And if he doesn't improve, we cannot continue him in the 10th standard. And then the parents go into shock in the 9th standard. And it's very sad that over the last 20 years, I have diagnosed so many ADHDs, so many learning difficulties, which should have been diagnosed in the primary school itself if we are vigilant. And if the remedial coaching starts so early, these children certainly do well. But unfortunately, up to 8, and the child gets labeled as a bad behavior. You know, ADHD, because of their attention deficit, are quite disruptive in class. They may disrupt the teacher, they may, for attention seeking, they may trouble the other children. They are not able to study for a long time, but they can play video games and they can play something for hours together. And all this gets labeled as a bad boy, bad behavior. And when we tell the parents that this is not a bad behavior child, your child has a problem about ADHD, or this child is not a child who avoids studies, but because he has learning difficulties, or he doesn't like maths, he doesn't like languages, because he finds it very difficult to study. And when he starts studying because he has difficulty, he will now, to divert his mind, play video games. He will watch TV for a long time. And all this sometimes, fortunately, the parents accept, though they are very sad and shocked that this was missed. And then if the parents accept, even though late, this child has some future for improvement. But I've got a lot of parents who still are in denial. And they say, मॅडम आजकालचा तुमचा मम्बो जम्बो असतो, सगळ्याला तुम्ही सायकोलॉजिकल हे करता, आमचा पोरगा एकदम वाईट आहे, त्याला नुसत्या 4 धपाटे पाहिजे. And if they refuse to accept that the child has a genuine difficulty and continue saying he's lazy, he's irresponsible, he's a bad boy, he requires strict discipline, then it's really tough. And we feel very sad for these children because already the time has gone when they should have undergone remedial coaching or some medication. It's already too late in the year of the 9th standard when 10th standard is looming. And where even normal children are finding a lot of difficulty, imagine a child who has been diagnosed recently with ADHD and learning difficulty, what that child must be going through. And I've often persuaded parents to take a drop or repeat 9th so that that year is now concentrated, because nobody wants to take a drop in the 10th because they feel the year will go waste. It will be a mark and a blot on his career. But if they come in 9th, I request them to take a drop so that in that year, we can then start remedial coaching. We can start behavioral therapy. We can start medications if required. And I have a lot of children whose parents have agreed to this, doing very well in CBSE. In fact, 3-4 of my patients have got 98%. And they have gone on to become in, IIT and medical. So when you get flag signs, we have to also, as I said, interpret them, whether there's a reaction to the behavior which is going on in their parents. Is this a dysfunctional family? Because then your treatment and your management is on a totally different thing, because these parents require marital counseling. And I've landed up doing marital counseling to these parents, making them understand how their behavior is constant fights and constant labeling each other is affecting the child. And once these parents learn how not to misbehave in front of their children, and whatever fights they want to do, not to do in front of children, there is a dramatic difference in the child, because now the child gets security. He feels his parents are not going to divorce, which is a great fear in the minds of these children. And then they're able to now cope up with their studies and academics and other things, because the family life is now more stable. There's more happiness in the house and things improve. Yeah. So some of these things are practical, that yes, we should be ready for flag signs, but we should also interpret the flag signs in the proper milieu about seeing the child's personality. And some of the flag signs, yes, I have diagnosed borderline personality disorder. I've diagnosed early schizophrenia. I've diagnosed psychiatric bipolar disorders. So yes, flag signs are extremely important, but we are not, as doctors, we don't just treat lab reports. So similarly, we don't just treat the flag signs. We have to go into deep psychiatric history, personal history, so that we can appropriately interpret the flag signs and accordingly do the needful. And as Shailaja said, flag signs in suicide is extremely important, because if we can pick up the flag signs and we can teach parents at home and peers in school and teachers in school, we can save a lot of suicides. Because when suicides occur, and I've done a lot of suicide counseling, grief counseling of the survivors, because once a suicide occurs in that school, the entire class is traumatized. They go into real grief, and I've done these grief counseling sessions, and there you find out that yes, the peers knew these are the flag signs, the teachers knew, but had they been aware that these were the flag signs, they could have helped the child, they could have told the parents, and some of the suicides could have been definitely averted. So knowing flag signs is very important, and I congratulate Chitra Jayashree for choosing this topic and choosing Shailaja, who's an excellent speaker, who really did justice to the topic. Thank you.
Thank you, madam.
Thank you.
We have learned and we are learning from you, madam. Always we learn something whenever you speak. Thank you, madam.
Thank you so much. Now the forum is open for few questions. Suryakant sir, you want to ask some question? Yes, please. Sir,
you
please
will be
unmute.
okay.
Sir,
Sir,
unmute, please.
Unmute, yeah.
It was wonderful for us, all of us, because we are general pediatricians and we do come across these common problems. And I wanted to know who is responsible, because I am associated with 4 schools, and many times as a pediatrician and a committee member, I get queries from my school authorities also and teachers. Are we legally responsible, like a management, that we should report this to the parents and take a parent's consent before talking to the students? Because adolescence is the age where they cannot take their own decision, and management in a hurry sometimes take a call and they start talking to the students with the help of the teachers, those who are not trained. So that is one question, is regarding legal responsibility of management and who is responsible. And second one is, as you have said, that the red flag signs are so many that it is very difficult to pinpoint to particular cause. And I think in a enthusiasm, if we teach the say parents or teachers, there will be chaos. So who should take the major role in identifying? These are 2 questions.
Just for the forum to know, Dr. Sankhe has 3 schools. He is a trustee of a CBSE school, a general state board school, and a school for specially disabled. Dr. Sankhe is a good, he has done a lot of work in child psychology as well as social service.
Yes, Dr. Shailaja or Dr. Swati Bhave, ma'am.
Yes, actually, legally, ethically, whenever that teenager or child is in campus, management is responsible and teachers are responsible. But it is a joint responsibility. Legally, ethically, whatever happens in the school, we are responsible, where management and teachers are responsible. But as a whenever we are talking about legal things, it is the place where it occurs. But now legally also it is compulsory for each and every school to have a counselor. I'm not able, I should not comment about the quality or whatever the counselor does, but they should at least know when to take help of the healthcare worker like us, or when to refer. And whenever there are early flag signs, particularly I'm talking about suicide because it is easy to understand. Whenever there are signs, flag signs, we must write and give the referral letter. We must keep a particular proof of reference so that we can become legally safe. And it is better to communicate with the parents. And whenever we are counseling to the adolescent also, there means confidentiality is important, but we must break the confidentiality. Whenever we are counseling at initially, I will break the confidentiality if I see that there are some things which may harm to you or may harm to others. If it is life threat like that, we should tell at the beginning only. And that we should tell the adolescent that before telling to your parents, I will communicate with you. Then only, with your consent only, I will communicate with your parents. So that adolescent will open up also. But if we find some signs, we should communicate with the parents also. I think madam will add more.
I would like to share the experience of my NGO, Association of Adolescent and Childcare in India, which we started in 2007. So it will complete 17 years this July. So Suryakant, for your legal question, whenever AKI holds programs for adolescents or the parents in school, we normally give a letter to the principal and we outline the topic and we give the contents of what we are going to cover. And we also tell them to take parental consent so that the parents are well aware
Yeah.
that this is the team of doctors and these are the topics which we are going to cover in their things. And we allow the parents also to attend. So the awareness which is there, it is the management's consent, the principal's consent, and the teacher's consent, and the parents' consent. And once we do that, we are quite safe in the sense that we come and say that here we are to increase awareness. So this is mainly public education, giving you importance. But if any of you have questions to ask, we put them in a question box. And where we do not ask for the name unless they want the name to be identified. Some people do put their names and then we announce this question asked by so and so, or we just put an anonymous question. And at the end, we always put on the screen our our email addresses, our telephone numbers, and we say if any of you want personal advice or anything, please feel free to contact us. So that whatever we have taught them, whatever fear they may have, they will come to us for, and this is not soliciting practice because many of this thing we give free of cost. So we not only create awareness, but we also give them a source of coming for help and guidance. And this is done in a very proper manner, so all the records are maintained. So all this is always recorded, maintained, so we are not worried about any legal repercussions or scaring the parents. And what lecture Shailaja gave, this was a very detailed lecture because we are giving it to pediatricians. But when we give the red flag signs to the parents, we choose very specific signs in each problem. That means in ADHD, we'll choose 5 signs. In substance abuse, we'll choose 5 signs. So we use key flag signs in each of the problems. So the parents are not overloaded or confused or overwhelmed with the red flag signs. But when we give them just 5 key signs per disease, they are also more aware. I hope that answers your question.
Yeah, thank you, madam. Thank you very much.
Dr.
I feel-
Joshi sir wants to add something. Yeah.
Yeah, but 1 second. But I feel, Dr. Sankhe, you are having free schools. That is great that you are interested in adolescent health, but
Yeah.
we must, along with academics, I always feel that teens friendly or mental health things should be also taken care. And there should be one certification that adolescent friendly health initiative, like adolescent friendly schools initiative should be taken. That's what I feel. And please think over it. And we are having many team members.
If any programs are available, madam, you can
Yes,
give us
yes.
material.
Yeah, you can just write to us at AKI. We are
Yes.
always happy to collaborate and
Yes.
we will love to share our modules. So please contact me or even Shailaja. Shailaja is our AKI National Coordinator for Teachers, and we have a very robust AKI programs going on in DY Patil with our youth peer educators and in DY Patil itself. So you're welcome to contact us anytime.
So our
And we can
president
get our
Jayashree, we
details
can
from-
get the material, and in our branch at least we can start
Yes, but
sharing
normally
the
what we
knowledge
do
with
that-
our.
Yeah, we share the material after we have trained you under AKI Master Trainer program. Because once we train you on our Master Trainer program, then we absolutely allow you to use the material. And in collaboration with you and our AKI banner, we are doing joint collaboration with many people.
Thank
You're
you very
welcome.
much.
Yeah, we can, madam, we can send a request on email
Sure.
and do the workshop accordingly.
Sure. And
Yeah,
another
thank
thing
you.
which I wanted to say, Shailaja, this adolescent friendly schools
Yes, ma'am.
initiative was done long back by the AHA.
Okay.
And this was when Dr. C.P. Bansal was the chair. And we have modules also of adolescent friendly schools. And these
So,
are well
yeah,
done.
adolescent friendly school initiative is there, but there should be some certification so that school will
We
have
have tried
add-on.
that,
They
but
can.
then we found that it is not very easy to sustain.
That
And
is-
it somehow didn't, but you're right. Like
Yes.
we have even baby friendly health initiative, baby friendly hospitals. It's very important that we can do a certificate.
Yes, yes. Thank you.
Dr. Hemant Joshi sir?
Yeah. मॅडम तुमचा टॉक वंडरफुल झाला.
थँक्यू सर, थँक्यू. मॅडम इज ऑल्सो हिअर. हॅलो मॅडम.
आमच्याकडे मराठी आई बाबा येतात ना, आम्ही तुमच्यासारखं वंडरफुल बोलतो. ते आमच्यासारखं वेड्याकडेच बघतात, त्यांच्या डोसक्यात काय जात नाही आणि ते आम्हाला फुल म्हणतात आणि नुसतं फुल नाही वंडरफुल पण म्हणतात. आम्ही जर हे मराठीत बोलायचं असेल ना तर तुम्ही आम्हाला मराठीत शिकवायला पाहिजे. आमचं गार्बेज इन गार्बेज आउट 75 वर्ष गेले.
नाही, मी विचारलं चित्राला, ती
हा.
म्हणाले की पूर्ण
नाही.
मराठीत नाही समजणार सगळ्यांना.
नाही
सर
नाही
आपल्याकडे
नाही that is okay.
सर आपल्याकडे
That is okay.
हिंदी आहेत, ऑडियन्स हिंदी
नाही
आहे.
नाही नाही, पटलं ना मला, पण त्यांना आपलं बोललं की मराठी पण येईल, त्यांचा डबल बेनिफिट आहे. त्यांना मराठी पण येईल आणि त्यांना तुम्ही हिंदीत पण करा. जो ऍडोलेसन्स इज ऑल काउन्सिलिंग, जोपर्यंत आम्ही इंग्लिशमध्ये करत राहणार, आम्ही ग्रेड 2 ग्रेड 3 च राहणार.
हेमंत,
जर आम्हाला ग्रेड
आम्ही
1
जेव्हा
करायचं
जातो ना
नाही,
प्रोग्राम
counseling-
करतो तेव्हा
counseling
आम्ही
करता-
हिंदी, मराठी, इंग्लिश तिन्ही मध्ये तेच बोलतो. आम्ही आधी त्यांना विचारतो तुम्हाला कुठली भाषा आवडेल आणि कुठल्या भाषेत तुमचा कम्फर्ट लेवल आहे. आणि जेव्हा आम्ही
झालेलं
मराठी
आहे.
शाळेत जातो आम्ही मराठीतच
झाले ना?
बोलतो.
मी केले
हिंदी शाळेत जातो तेव्हा हिंदीतच बोलतो आणि
हा.
बाकीच्या इंग्लिश मीडियम शाळेत जातो तेव्हा इंग्लिश मध्ये बोलतो. तर
हा.
पहिल्यांदा आम्ही ऑडियन्सला कम्फर्ट झोन विचारतो की तुम्हाला कुठली लँग्वेज सोपी पडेल. आम्ही जाऊन उगीच वाटेल त्या भाषेत बोलत नाही आणि त्याच्यामुळे पूर्ण मराठीत सुद्धा आम्ही बोलतो मराठी शाळेत जेव्हा जातो.
Swati, you are great. Our issue is that BAMS, LCPS, blah blah succeed कारण त्यांचं बोलणं कळते आणि जास्त जेवढं आम्ही शिकलेलं आहे ना, आमचं बोलणं अगम्य होऊन जातं. इट इज डायरेक्टली प्रोपोर्शनल टू अवर स्टडीज ऑर व्हॉट
नाही रे बाबा हेमंत, आम्ही अगदी सिंपल लँग्वेज
It's not you.
त्यांच्या
It's
लेवलला
me. I'm telling you about me. I suffer from this.
नाही नाही तू उगीच बोल नको, तू पण छान बोलतोस. मी ऐकलंय तुझं सिंपल लँग्वेज.
तर आपण नाही ऐका ना, पुढच्या वेळी हिंदीत करा ना. हिंदीची काही भांडण नाही आहे. हिंदीत करा, मराठीत करा.
तर मध्ये मध्ये मी बोलले हिंदी मराठी थोडं थोडं.
हो.
सर
आणि ते
now I
शक्य झालं, मॅडम.
request Dr.
I'm
Nishika
happy.
Kotwal
I'm
sir.
happy.
He wants to give his message. Kotwal
Kotwal
sir.
sir is our adolescent member, young, smart.
सर
T-shirt.
गुड
Yes sir. Sir
Unmute.
please unmute.
सर गुड आफ्टरनून सर. अनम्यूट करा सर.
हाय निशिकांत, हाऊ आर यू?
सर अनम्यूट करा.
Nishikant
Sir
is still
please
16.
unmute.
Nishikant is still 16 years old.
Sir please unmute.
Nishikant is my college mate from Nagpur. So we know each other over years.
कोतवाल सर अनम्यूट करा.
सर अनम्यूट करा, तुमचं बोलणं ऐकू नाही येते.
Yes sir.
परत म्यूट झालं.
परत म्यूट झालाय.
आता
आता
unmute
तसंच
करून
ठेव.
मी. Okay. Nee, can you hear me now?
Yes.
It is very difficult to speak after Swati has spoken few words. त्याच्यानंतर इट वॉज अ वंडरफुल लेक्चर. आणि हेमंत जोशींना आपण जे म्हणतोय की मराठीतच बोललं पाहिजे, बट महाराष्ट्रामध्ये बोलत असताना मराठी आणि हिंदी या दोन गोष्टींचा आपल्याला वापर करावाच लागतो. बिकॉज एव्हरीबडी डझंट अंडरस्टँड मराठी ऑल्सो. आणि एस्पेशली जेव्हा आम्ही नागपूरमध्ये राहतो तर विच इज इन द बॉर्डर, वी हॅव टू यूज हिंदी ऑर इंग्लिश. पण जेव्हा आपण इंग्लिश शाळांमध्ये जातो तर तेव्हा आपण इंग्लिशचा वापर करायला सुद्धा हरकत नाही. बिकॉज वी बिंग ॲलोपॅथ्स वी हॅव ऑल बीन ट्रेन्ड टू स्पीक इन इंग्लिश अँड समटाइम्स इट इज व्हेरी डिफिकल्ट दो वी आर महाराष्ट्रीयन्स टू कन्वर्ट इट इन टू रिअली एक्झॅक्ट नाईस वर्ड्स. पण जोशींसाठी मला असं वाटतं मी मराठीत फक्त 2च कॉमेंट्स आता ठेवलेले आहेत. कॅन यू हिअर मी?
Yes,
All
yes.
can hear? Sankhya sir,
Yeah.
the problem which you had raised, I am telling you, there is a definite policy of consent and confidentiality when we are dealing with a problem with the adolescent. तर त्याचं शैलजा मॅडम फार चांगलं बोलतातही त्याच्यावर, पण त्यांनी चांगलं सांगितलेलं राहील आणि शी विल शेअर विथ. ओके. आणि पालकांसाठी फक्त 2च गोष्टी फार महत्वाच्या आहेत, विच इज व्हेरी इम्पॉर्टंट फॉर अस ॲडोलसंट्स टू टॉक विथ द पॅरेंट्स, ॲडोलसंट काउन्सिलर्स. पालकांसाठी आहे की शब्दांचा मार, शब्दांची धार, शब्दांची जखम ही फार जबरदस्त असते आणि शब्दांचा झालेला मार लवकर बरा होत नाही. त्यामुळे आपण शब्दांच्यासाठी जे काही बोलतोय ना, तर शब्द आणि पालकांना जेव्हाही मुलं डिप्रेशन मध्ये असतात ना, तर तेव्हा एक मराठी कविता जी होती ना, शब्द वाचून कळले सारे शब्दांच्या पलीकडले. That means here we are talking about a body language of the child and his difference in the behavior pattern which was previously there and a changed behavior pattern now. If you understand these two, I think we can spot as a parent, or we can enrich the knowledge of the parents on these 2 points, and they can pick up whether their child needs help or not. Either they, by talking with the child, they can solve many problems or come down to us. Thank you.
थँक्यू. आपण कार्यक्रमाच्या संपूर्णतेकडे येतोय आता. अँड मे आय रिक्वेस्ट सेक्रेटरीज डॉक्टर अजय कोळी और पालघर IAP सेक्रेटरी डॉक्टर अनुराधा पालवणकर टू गिव्ह वोट ऑफ थँक्स.
I think Anuradha is not there. So
Yeah, please
behalf-
give vote of thanks. Yeah.
on behalf of Palghar Academy of Pediatrics आणि आपण पालघर Academy of Pediatrics, सॉरी सर, मी आज मराठीतनं आभार प्रदर्शन करते. पालघर Academy of Pediatrics, AHA रायगड आणि IAP रायगड यांच्या संयुक्त विद्यमाने जो आज आपण कार्यक्रम केला, त्याच्यामध्ये जे आपल्याला स्वाती भावे मॅडमनी, डॉक्टर शैलजा माने मॅडमनी आणि हेमंत जोशी सरांनी, तसंच डॉक्टर संखे सरांनी, डॉक्टर कोतवाल सरांनी जे जे सांगितलं आहे ते आपण आजपासून सर्व पालकांपर्यंत, सर्व विद्यार्थ्यांपर्यंत घेऊन जाण्याची शपथ घेऊया. आपण त्याबद्दल आपली एकनिष्ठता किंवा प्रतिबद्धता दाखवूया. आणि तुम्ही सर्वजण आले या सर्व वेबिनार मध्ये, तुम्ही आम्हाला जो गायडन्स दिला, डॉक्टर अर्चना जोशी मॅडम तुम्ही पण आला आणि सगळ्यांनी आपले जे इनपुट्स घातले, जे जे सूचना दिल्या ते आम्ही पाळूया. याबद्दल मी मनापासून आपल्या सर्वांचे धन्यवाद देते.
Yes, I want to extend my thanks to our living legend, Dr. Swati Bhave ma'am, speaker, Dr. Shailaja Mane. She's so inspiring and so busy, still she gave her time. And our coordinator, Dr. Neha Singh. Without her, this program was not possible. Thank you very much.
Thank you.
I just forgot to say that Chitra and Jayashree are active AKI members, and they have
Yes.
conducted many programs under AKI banner. So I am very grateful and blessed that I get people like Shailaja, Chitra, Jayashree who work with us, which has kept me going. Thank you.
And we are grateful and blessed to have you, madam.